What's wrong?
Ventricle. Fix!
I don't understand.
Ventricle.
I don't understand. What are you saying? Now, be calm. Stay calm.
What are the ABCs here? In this scene, the B, behavior, is the patient's agitation. She is repeating her message, which is not being understood, and shaking her dress. The A, antecedent, is the patient's frustration over not being able to communicate. The C, consequence, is the caregiver expressing that she cannot understand the patient. Notice the patient is getting more agitated. In this case, identifying both the A, antecedent, and the C, consequence, are equally helpful. The A was the patient's frustration with the task and not being able to do it. Language deficits may trigger problem behaviors and complicate caregiving. By learning to respond in a helpful and appropriate way, caregivers can help to minimize the problem behaviors, such as agitation, tearfulness, and withdrawal. In most of our examples of behavior problems, if you could change the A, antecedent, you could change the behavior. Language deficits are a little different, though. The patient is trying to communicate, and often your response, the C, will help or hinder that attempt. Let's look at this scene.
What's wrong?
Ventricle. Fix!
I'm sorry, I don't understand.
Ventricle. Ventricle.
Dress? It's a nice dress. Would you like to put it on? Well, I'll be happy to help you put it on.
What are the ABCs here? As in the first scene, the B, behavior, is agitation. The A, antecedent, is the patient's frustration. The C, consequence, is changed. Instead of merely saying, "I don't understand," the caregiver tries to guess what the patient wants to say. Sometimes this can cause increased frustration for the patient, but oftentimes it helps. The key to changing behavior is to attend to the ABCs and try to change the sequence of events and thereby change the behavior. For example, a way to change the antecedent would involve breaking the task of dressing down into more manageable steps so the patient wouldn't get frustrated. It is often difficult to understand the language of a person with dementia. They often have trouble finding or saying the words they want to say. This trouble may sometimes make the person very agitated and upset. If the person is made anxious, the word-finding problems may be worse than usual. Here are some approaches to a person who has this kind of problem. Allow enough time for the communication to occur. People with dementia require a great deal of time to process things. If the patient is having trouble communicating with you, or you are having trouble being understood, try to demonstrate what you are saying. Maintain good nonverbal behavior, including eye contact, touch, smiling, and moving slowly. This will often help ease communication difficulties. Provide the person with multiple clues and words that might be the one the person is looking for. Try to fill in the blanks for them. But make suggestions one at a time and leave the patient plenty of time to answer, or they may begin to feel overwhelmed. If you and the patient are both becoming frustrated, change the subject or try to reassure the patient. Try again later. Sometimes you just can't understand the patient's message, no matter how hard you try, even though you feel they are depending on you. Remember, you must stay calm, especially if the patient is upset. In the tapes that follow, we will show you other difficult behaviors and how these behaviors can be observed, broken down into ABCs, and changed.